Thank you for listening to Depictions Media Radio. Welcome to Policy and Rights, the show about human rights and government policy. Welcome back, everyone. And over the weekend in Florida, the numbers for COVID-19 really had a spike at 15,000 new documented cases right after Disneyland opened. It is so far the largest documented spike in COVID-19 to date since the pandemic has started. And we have next up a press conference addressing what is happening around the world with the WHO, with Dr. Michael Ryan and Dr. Maria Ann Kokoff. So listen to what they have to say on this topic. There will be a direct question asked about how to curb what is happening with such spikes in COVID-19 happening especially in countries like the U.S. and other places where it just seems to be out of control. So let's listen to what the WHO has to say.
So our next question is for Imogen Fuchs of the BBC. Imogen, can you unmute yourself and go ahead, please?
Hi, Margaret. Thanks very much. It was primarily a question for Dr. Tedros, but Mike and Maria, I think, I'm sure you can answer it as well. Dr. Tedros said the Americas remained the epicenter of the pandemic. And I'm just wondering, looking at really big increases in cases that we have seen, particularly over this last weekend, on a public health basis, what's gone wrong and what needs to be done as a matter of urgency?
If we look at the Americas as a whole, I think both, and the DG alluded to this, in many circumstances, countries made some progress in suppressing transmission, but certainly the reopenings in those countries have led to more intense transmission, and now a number of countries face a scenario in which there's increasing and sometimes exponential transmission, a very difficult situation to face, and not necessarily with the option to impose these so-called lockdowns again because of the economic damage and the community acceptance of those. But as Tedros said, there is no situation which cannot be faced, and I think this is the issue, is to turn and face the fire, turn and face the problem, and accept that it's going to take time. It's going to require a huge commitment on the part of government and individuals in a number of countries to turn this around. And it's not just government. It's individuals, the choices we make. I think I spoke about that last week. There are choices that we all make that can either increase or decrease the risk of transmission. But there are choices that governments make that can either increase or decrease the risk of transmission. We need to re-establish trust, communication, and strong government-led strategies that can turn this around. Some of that may require limited or geographically focused lockdowns that suppress transmission in specific areas and where transmission is frankly out of control. But that is not the case in all places. All countries in the Americas have areas in their countries in which transmission is at a reasonably low level. But some areas in almost all countries have areas of intense transmission. And in those situations, absolute individual and community adherence to social distancing, hygiene, the wearing of masks when appropriate, all of those different things. If everybody does that, then we will suppress transmission, avoiding crowded places. But if people continue to frequent crowded places without taking the necessary precautions, if people aren't practicing physical distancing, if people aren't practicing hygiene, if people aren't wearing masks in the proper settings, then the disease will continue to transmit. At the same time, governments have to support communities in that, and governments have to be, again, Tedros spoke to it very clearly. We need to be absolutely clear and consistent in our messaging to our citizens, and it's got to be easy for citizens to comply. It's got to be facilitated, and it's got to be supported. So, and within all of that, as we get control back of the disease, and I can't say this strongly enough, the countries that have put in place strong public health surveillance architecture while they've been dealing with their lockdowns are now emerging from those lockdowns in a stepwise fashion, and they're replacing lockdowns with strong public health capacity to detect, to test, to quarantine, and to treat cases. And countries that have taken that path are having relative success in continuing to suppress the virus. But as I've said here before, we need to learn to live with this virus. Expecting that we will eradicate or eliminate this virus in the coming months is not realistic. And also believing that magically we will get a perfect vaccine that everyone will have access to is also not realistic. The history of vaccines are that we can and will develop a vaccine. The question mark is, how effective will that vaccine be? And more importantly and more worryingly, who will get that vaccine? And will that distribution be fair and equitable? But as Tedros has said, there are things we can do now. There are tools we have at our disposal now. If we apply them, and if we apply them systematically, and if communities and individuals buy into that and trust that their behaviour will be supported by government, and we can work together collectively to drive down and suppress transmission. The positive news in this is that in many countries death rates have fallen, and we are getting better at treating cases, we're getting better at diagnosing cases early, and we need to continue that. We need to suppress mortality, suppress transmission, we need to support communities, and we need clear and strong government leadership. And that doesn't matter where you are, but that's all the more important in countries that are now suffering very, very exponential transmission, which is very, very worrying.
Thanks, Mike. I want to speak to the individual. So as Mike has said, it's not only about leadership, it's about individuals and what individuals do. And everyone on the planet needs to know what role they have to play and to be informed about what this virus is, where this virus is circulating, especially in the areas where you live, the areas where you work, the areas that you want to travel in. All of this is important. There's so much that you can do yourself to protect yourself from getting infected and to prevent yourself from passing the virus on to others. And please make good choices. I know that there are a lot of things that we want to be doing right now, but there aren't necessarily a lot of things that we need to be doing right now. There are many people, essential workers who cannot stay at home. There are many people who are caring for patients in hospitals who cannot stay at home. And if you can, and if you can help, and if you are asked to, please stay home. You can practice physical distancing from others. You can avoid crowded places. You can avoid places that have enclosed settings that have poor ventilation. You can clean your hands. You can practice respiratory etiquette. You can wear a mask if you cannot do physical distancing. There are so many things that you could be doing, talking to your children, explaining to them the risks. Everyone has a role to play. And this is far from over. So we all have to play our part.
Thank you very much, Drs. Ryan and Van Kerkhove. We have time for one more question. He's been waiting for a long time, and so he gets the last question. It's Jamie from Associated Press, Jamie Keaton. Jamie, please go ahead.
That's okay, Margaret. My question was for Dr. Tedros. Thanks.
Okay, well, Dr. Ryan's got an update on Ebola because last week we promised that we would give that updated situation. So, Dr. Ryan, please go ahead.
Yeah, this one goes out to Helen Branswell. Sorry, Helen. The dog ate my homework on Friday. I'm back, suitably contrite. As of the 12th of July, we've had 48 confirmed cases and 3 probable cases reported from Equator Province in north western DRC. We had 17 deaths of confirmed cases and the three deaths of the 3 probable cases, 11 survivors. We've had 21 affected health areas in 6 health zones in Equator. And that does, while the numbers are low, that does represent a broad geographic extent of the virus, and that is of a concern. While the numbers are quite low in each health zone, any one of those individual cases can result in amplification of disease. In terms of the areas that are affected, there are 5 zones that we've had cases in the last 21 days, and most of the zones, in fact, have had a case in the last 7 to 10 days. So we're still within that incubation period for another wave of cases in the zones of Bikoro, in Balomba, in Iboko, in Lutumbe, and in Bandaka itself. In terms of the age and sex distribution, males predominate amongst the cases. Females represent 43% of cases, and children less than 18, 6% of cases. In terms of the epidemiologic links, at the beginning of the outbreak, as is normal in many Ebola outbreaks, it's difficult to make the association between cases because sometimes there are difficult exposure histories, and particularly when people have already died. But at present, the documented, at the beginning of the outbreak in the first week, 75% of cases had no documented epidemiologic link. From the 29th of June to the 5th of July, 33% had no documented link, but all cases in the last week have had documented epilinks to other cases. That's good news. The difficult part of that is that the proportion of people who are registered and followed as contacts is less than half. And that means that, half of cases are not being actively followed as contacts when they're diagnosed. And again, while the numbers of those are very, very small, that is not a good parameter. And again, in terms of deaths at community level, where we've seen 9 deaths in the community, again, they all represent opportunities for disease transmission. At the moment, as of July the 11th, we're tracking 5,580 contacts across a very, very large and difficult geographic zone with extreme logistics. We've managed on a daily basis to follow 4,977, or 89%, nearly 90% of those contacts are followed on a daily basis, which is a good performance in the context of the extreme logistics in the area, but it also means that 10% of contacts are not followed, and that in itself is a concern. In terms of community alerts, we're investigating or detecting about between 500 and 600 alerts at community level every day. Of them, 25% are validated as suspect cases, and then those individuals are tested. There are still challenges in testing. We've very recently established testing capacity in Bikoro, which is to the south. So we now have testing capacities in all of the affected health zones. And we have clinical capacity with partners in all of the affected health zones. Just to say that the distances, the logistics, and the demands on all of the teams, the ministry teams, the partner teams, and WHO teams are extreme. It is not the same context as North Kivu. We don't have necessarily the same security issues, but we do have very, very demanding logistics and distance and living conditions for staff, and the condition of the roads, etc. We've vaccinated thousands of people with our vaccination teams, and we're very lucky to have that and those vaccination teams in place. And equally so, therapeutics are in the field and now being actively used to treat cases. The R0 for the last 2 weeks of June was 1.7, which means, technically each case is generating more than one other case. So this is still an active, very active outbreak. And I would say it is still a great concern. The Equator province is on the River Congo. It is also across the river from 2 other countries. It is a very, very large geographic area. Communities are linked and people do travel long distances. So there are a number of features of this epidemic that are of concern. Very much thank the government of Congo for its leadership, the partners in the UN and the NGO system for the support they're providing. But I would caution everyone that while the numbers in this event are low, again, it's in the era of COVID, it's very important that we do not take our eyes off these other emerging diseases. And we saw in North Kivu and in other previous outbreaks of Ebola that these can get out of control very easily. We're very focused on continuing to support the government of Congo in eliminating Ebola once more in this situation. Thank you.
Thank you very much, Dr. Ryan. And with that, I'll close this press conference for today. We'll send the audio file, as usual, to the Globalist. And the next press conference will be on Friday. That's Friday, the end of this week. We'll look forward to speaking with you then. Goodbye.
So the question is, are we opening up economy at the risk of human life? Are people really listening to the idea of hygiene and social distancing? Or are we truly listening to how and when to wear a mask so that we can protect ourselves from this virus? As it was said in today's press conference with the WHO, that we need to focus on how we can protect ourselves, because when we protect ourselves, we are protecting everyone else around us. Thank you for listening to Depictions Media, and please click the subscribe button so you don't miss any of our updates. This show has been produced by Depictions Media. Please contact us at depictions.media for more information.